Thank you. Okay, give everyone just a minute to land in the Spanish room and get started. So good evening, everyone, and welcome again to the Fentanyl Town Hall. My name is Rita Hewitt, and I'm the program manager of SafeRx Santa Cruz County, an action-oriented collaborative that is dedicated to equitably aligning and accelerating best practices for opioids and other substances with the goal of reducing harm and death. I'm also a third-generation lifelong resident and a parent who cares deeply about this issue and our community. Tonight's town hall will focus on providing both fentanyl education, listening to your comments and questions, and answering those questions. And it's my hope that we can engage together as a community and identify ways that we can prevent opiate and drug-related deaths. Next slide, please. Thank you. So this topic is extremely sensitive, and we recognize that it may be emotionally difficult or triggering for some folks. So please take care of yourself in whatever ways you need to during the event. Thank you. Next slide. Okay, for whatever reason it is that brought you here today, I want to acknowledge that addiction does not discriminate, and it affects the lives of almost everyone in our community on a personal level. We would like to elevate this discussion of substance use into a normative space without stigma, secrecy, or shame. Keeping this in mind, I'd like to pause for a brief moment of silence for those that we have lost, the lives that have been affected, and hold space together as a community. Okay. And we can all just take a deep breath. This is a heavy topic, so thank you for that. Next slide, please. And I just want a special thanks to our panelists tonight. During the Q&A portion, you'll have the opportunity from a wide array of community leaders from sectors such as law enforcement, health services, and community organizations working on this important issue. It's a privilege to partner with you all, and I deeply appreciate the work that each and every one of you are doing to improve the health of our community and being here tonight to engage in dialogue around this topic. Next slide, please. So why are we here today? All communities and populations now are impacted by fentanyl. From the person who tries drugs for the very first time, to teens experimenting, recreational users, and those struggling with substance use disorder or addiction. We are seeing an increase in deaths due to this substance. These deaths, these are our people. They're our family members, our friends, our children, our neighbors, colleagues. They are us, they are our community. And it's important that we address this as a whole community. And so we're here tonight to come together, to learn from one another and work toward navigating a path forward. We recognize that we don't have all the answers. Just because we're here as panelists and presenting, we need help from the community and to address this issue collectively. This gathering is one of the initial steps to informing next steps as a community to address this crisis and hearing input of the community. Next slide. Thank you. And so we need to talk about it. So we're here and thank you for coming. The past 2 years have been extremely difficult, challenging, and isolating. The combination of COVID-19 and fentanyl-related deaths makes 2021 the deadliest year on record in the United States. And this has resulted in lowering the life expectancy by nearly 2 years. Annual drug overdose deaths have reached record highs in the United States, surging to unprecedented levels. Estimates show that over a 12-month period ending in October 2021, that roughly 105,000 people lost their lives to drugs. And roughly 2/3 of these deaths were due to synthetic opioids such as fentanyl. And this is nearly 4 times the number of deaths from the previous 12 months. So a significant increase we're seeing. And in some areas such as San Francisco, the loss of life from fentanyl-related deaths exceeded that of COVID-19 deaths. Furthermore, the Centers for Disease Control found a 94% increase in teen opioid overdoses between 2019 and 2020. And locally, we've seen an increase in fentanyl-related deaths among teens from 1 in 2020 to 4 deaths last year. Next slide, please. So what is fentanyl? Fentanyl is an ultra-potent synthetic opioid. It is 100 times more potent than morphine and 50 times stronger than heroin. As prescribed, fentanyl is commonly used to treat pain of cancer patients, end-of-life care, post-surgery, things like that. And it can be highly addictive and fatal in the smallest amounts. And I just want to direct our attention to these images here on the far right, you can see the penny there, and there's just a few grains of fentanyl next to it. That is enough to be a lethal dose. So you can imagine how tiny that is to see in a drug supply. And the further image of the two bottles show a lethal dose of heroin and fentanyl. And then the last image shows an amount of a small sugar packet that we often see at coffee shops. That's enough to kill hundreds of people. And so as you're hearing this, you might ask why? Why are we seeing this increase in fentanyl? And there's various factors for it. It is a synthetic opioid, which means that it is man-made, often done in unregulated settings, which results in no need for crops or farming. It's extremely inexpensive to both make and sell with a massive profit margin. Ingredients are also really easy to obtain. And as mentioned before, it's so small that it's easy to transport in the drug supply chain. It's versatile. It comes in many different forms, such as pills, powders, liquids, which makes it easily cut into other substances. Next slide, please. Thank you. And so now I want to take a look at kind of local data, what we're seeing here locally. So you can see the legend at the bottom. The orange represents opioid-related cases, and the blue results is total cases. So you can see in the beginning from 2014 to roughly 2017, both were following this downward trajectory. And in large part, that was due to increased awareness, education, and outreach to our local providers. Our community was able to decrease prescription-related deaths by nearly 40% from 2012 to 2018. And I'm really proud of our community and providers for coming together to be able to get that statistic down. We then started to see this increase again in opioid-related deaths, but this was due to a transition from those prescription opioids to illicit opioids such as heroin. And then you can see this kind of stark jump in 2019 is when we really saw an increase in fentanyl in our community. And that trend has continued through 2021, and preliminary 22 data is showing the same trend. Slide, thank you. Now this slide is similar, looking at specific opioids, the most common ones that we kind of see in our community, and they go from 2014 to 2020. Heroin has stayed kind of the dominant substance. You can see it's pretty leveled out, but then you can see methadone and hydrocodone prescription opioids have continued to decrease. And then if we just want to draw everyone's attention to the far right here, where it's fentanyl, you can see that it's going on this upward trajectory, and the red is 2020 data where the star is. So you can see the significant jump in fentanyl on there. Next slide, please. Thank you. So where or how is it commonly found? Fentanyl is present in a wide array of drugs that is sold on the street. For every pill, there's a counterfeit or a fake version of that pill. Common ones are Percocet, Xanax, and Adderall, and they look identical, if not better, than the real thing. So it's impossible to tell what a counterfeit is. And fentanyl can be laced and cut into other common drugs such as cocaine, heroin, ecstasy, and those pictures on the bottom depict kind of the different substances that fentanyl is oftenly found. So our message really we want folks to know is we can confidently say that most pills and substances on the street contain fentanyl, and please assume that anything bought from the street is tainted with fentanyl. Next slide, please. Thank you. So how do people obtain drugs? Friends, the internet, you can get them delivered by mail, dealers at local parties. But I think the most important thing for us to know is with this increase in social media, drugs can be ordered and dropped off as a delivery. It's almost as easy as ordering a pizza to your home. So we need to be diligent and sharing that knowledge. Thank you. And so you might think, why does someone want to use higher risk substances or unknowingly? So people use substances for a multitude of reasons. Some common ones are experimentation, thrill seeking, self-medicating, and trauma, as well as chronic physical pain. Next slide. Thank you. So what are some signs that someone may be using drugs such as fentanyl? So there's changes in mood, missing responsibilities, abnormal behavior. But I want to please note that sometimes we see these in adolescents and young adults that are not using substances. So that's why it's really important that we're connected and have dialogue and conversation with our loved ones to seek support if they need it and really connect with them. And now I'd like to transition to our physician consultant, Dr. Jen Hastings. Thank you.
Thank you so much, Rita. That was very helpful. I know we have all worked really hard to share information that's clear. We're now going to pivot to discussing how fentanyl causes death and the role of Narcan or Naloxone to prevent death. So an opioid overdose or accidental poisoning occurs when a person has too much opioid in their body. This causes the brain to stop signaling the body to breathe. There is no urge or stimulus for that person to breathe. When the breathing stops, the body doesn't get oxygen. Over time, this leads to organ damage, then brain damage, and if enough time passes, death. As you've already learned, because fentanyl is so potent, a very small amount can cause death. As you've also learned, a person may not know that what they took was laced or cut with fentanyl. So the terms accidental or poisoning are appropriate and are becoming more common. But what does a fentanyl overdose look like? A person with an opioid overdose or accidental exposure may show the following: slow or absent breathing, discoloration of lips and nails, small pupils, cold or clammy skin. They may be choking or gurgling, and the person is unresponsive. That's key. You cannot wake them up. We do have an antidote that can reverse an opioid overdose or poisoning if offered soon enough. Naloxone, brand name Narcan, which you've probably heard, acts at the level of the opioid receptors in our body and displaces the opioids off their receptors so that then your body gets the signal to breathe again. The most common form of Narcan is a nasal spray that's inserted up into the nostril, and when sprayed, begins to work within 2 to 3 minutes, usually within 90 seconds. Because of fentanyl's extreme potency, a person with a fentanyl overdose may need more than 1 dose of naloxone, sometimes as many as 4 doses. Narcan only lasts 30 to 90 minutes, so be sure to call 911 for help and stay with that person. Even if you're not sure if that person is not responsive because of opioids, you cannot hurt them by giving them naloxone. And because of our Good Samaritan law, there are no legal risks to giving this. And certainly this medication can't even be considered at risk of addiction. You can get a prescription for Narcan from your medical provider. There's now a California law that requires actually a Narcan prescription if you are on an opioid. And we are now training providers in Santa Cruz that in addition, a person does not have to be on an opioid medication to get a prescription because of the reasons we're sharing today. You can also get Narcan actually without a prescription from your pharmacy because the pharmacist has that ability in the state of California, and the pharmacist can bill your insurance. Medi-Cal, Medicare, and most insurances do cover it, but note that some private insurances often have a pretty steep copay for it. It's not an inexpensive medication. Do call ahead to confirm that your pharmacy has it in stock and is able to dispense without a prescription, because unfortunately, still not all pharmacists are aware of the furbishing regulations that allow them to dispense it independently. You can also get Narcan at our local ERs and at our community clinics. And we have prepared a Narcan resources document for you where you can get free Narcan in our county. And you can find this resource at our SafeRx website. We've created what's called a Padlet for all the resources related to today's conversation. So now we're going to talk about how you use Narcan. We recommend that you attend a training or watch trainings on YouTube. And we have several links, both in English and Spanish, in that resources Padlet that I referred to on our website. You can contact us directly if you want a training for your school or your business or some other group. We can also, if there's time and energy after the Q&A, share a short demonstration before we close for the evening. So what can you do as a parent or a community member? Each one of us actually can make a positive difference in our community, and we'll talk about some of those ways. One is to get informed about harm reduction practices and about the role of stigma. Drug use and addiction is profoundly stigmatized in our society. And this may include labeling, stereotyping, and discrimination. And it's rooted in the belief that addiction is a personal choice, reflecting a lack of willpower and a moral failing. But we now know that addiction is actually rooted in our brains, and it's a chronic illness. Further, stigma is why people keep drug use a secret, why, in fact, it's the most significant barrier to healing and positive change for individuals and for our community. Harm reduction practices are now a key part of the Biden-Harris administration. They're evidence-based, and they've been shown to save lives through prevention, treatment, and recovery services with the principle of meeting people where they're at, on their own terms. And we'll be putting links in the chat for more information on that, and that will also be in that resources document. You can also make sure that medications are in a secure place in your house. So safely get rid of medications that you're no longer using. And we, again, have resources for you on our website. Carry Narcan with you, have it in your car. And as we've already discussed, be sure to do a training so you can actually use it when you need to. And hopefully you won't, but this is kind of like a fire extinguisher. You hope you won't have a fire in your house, but if you do, you're ready. Conversations are incredibly important. Your relationship with the people you care about and the youth in your life is the best protective foundation that you can lay. Practice positive ways of communicating, listening without judging, role model healthy coping and relating. Bring this up with your kids. What do they do at a party to make sure that their friends are aware and watching like someone who's asleep on the couch? Make sure they know how to use Narcan as well and are ready to call 911. Talk early and often, and I'd just say avoiding the lecture this is dramatic, but if they see us as dramatic, they will ignore us. I want to say that we have several people on our panel tonight who can talk more if you have specific questions about that. And now we're going to turn to a few more resources before we get to your questions. One of them is this series of books that we found recently, which we will be sharing with our schools, hopefully this summer, in a partnership with the County Office of Education to support conversations about drugs. And these are booklets specifically for middle and high school families, and they're also on our website. We know that active listening with curiosity and caring, clarifying values, your values around drugs, holding boundaries, and being present are powerful tools to increase awareness and safety. We know that compassion over stigma is a very powerful message, and we're starting an active campaign that you can be part of to share your message about why you choose compassion over stigma. Help create safety for our loved ones to get the support they need when they need it. The link to share your words and story is also on our website. So now we'll just kind of look at this resources thing I've been talking about for a bit to show you the link to our website, a little bit about what it looks like, that Padlet, to find all the resources we mentioned today. Many are in English and in Spanish, including a lot on Narcan, a lot on treatment, parental support, and more. And so this is, I just want to take a moment to thank everyone in our community who is working to save lives and reduce harm. Our emergency medical services, our fire folks, law enforcement, health and human services, our harm reduction coalition, our community clinics, and countless other partners. So now it's time for your questions and comments. This town hall, as Rita has already said several times, is the first step to help us inform our next community discussion and future actions. We invite you to share your hopes and vision on how we can effectively deepen that connection to prevent further loss. A reminder for each of us when asking questions or making comments to hold kindness and respect for each other. We will not talk about specific cases tonight. I'll do my best to consolidate similar questions for the panel, and we'll be answering your questions both in writing on the Q&A space there and also verbally together. As you know, we have a diversity of panelists, and I anticipate some dialogue between them with more than one reflection on some of your questions. So we envision this evening as the first of many community responses. Thank you so much for being here. And I just want to add that all of these slides will be available to you. They'll be on our website, as will the recording in a day or so. So I think now we move to questions, and I have not been looking at the Q&A, so I think I see 3. And we have prepared a document for me, so I'm going to move to that. Okay, so I'm going to start with a comment that was posted. Let's see. My granddaughter, Alicia Hawkins, didn't die of an overdose. She died of a poisoning. That cocaine was purchased by a friend, was laced with fentanyl. She was one of the 4 found at Derby Park and the only one that didn't survive. This was October 23rd, 2021. She didn't overdose. She was poisoned. And I thank you for sharing this. And I really, my heart goes to you and all who loved her, and all of us in our community are responding. I hope today we're going to take movement. Do any one of our panelists want to add anything? I just want to say that, yes, I want to agree with you that this was a poisoning, and hopefully you heard that in the comments today.
Yeah, I can answer that. Being in Derby Park in the city of Santa Cruz, I think it's important just to understand, like was mentioned, that we are literally every day seeing fentanyl in everything. It's so people don't know what they're taking. We had an overdose death just 2 nights ago. And people are taking things where they think they're taking something safe, something that looks legitimate. And we're literally seeing things turned in every day, or coming across things literally every day, sometimes multiple times a day, that come back and test positive for fentanyl. So
thank you for your comment. There's a question as to whether you all of Laura, do you carry Narcan with you? Is that true for all the people who are on our streets and driving in cars?
Yeah, every single, actually, I have them here sitting on my desk. Every single one of our officers carries it in their patrol vehicle. Every one of our CSOs carries it. They're all trained how to use it. And then additionally, we offer it up for if people have extra pockets and want to carry it on their person on patrol. They also have that option as well, and most of them do.
Thank you. Yes, thank you that you all have it. There's a question for clarification that Dave Gilarducci has offered to respond to. I guess my explanation didn't make sense, so my apologies. So there's a question, are there any risks to using Narcan? Dave, you want to go for it?
Yeah, I'd be happy to. And your explanation was fine, but it is very confusing. The Narcan is almost diagnostic for an opioid overdose. It really does not work unless the overdose is due to that reason. But if it happens to be an overdose that's not related to an opioid, there's really no harm in giving Narcan. Narcan does not have any other ill effects. So if you're in doubt, I would recommend using it. You're not going to cause any harm, even if it's due to another cause.
Thank you. Let's see. There's a question about schools. There are actually a few questions, and we have Jennifer Busing with us, so that's great. Is any work being done to bring this information directly to the school community, i.e. to youth? I have a child in middle school and one in high school. And although we talk openly about fentanyl and other drugs with our kids, I know that many families do not. How does a school community fit into getting this information out to youth? Thank you. Good question. Jennifer, do you want to unmute?
Yes, thank you. Thank you. Yes, we are so blessed that we are able to partner. All of our schools are able to partner with our nonprofits and SafeRx and our county health departments, as well as substance abuse and mental health departments, to join us in sharing this information with our children, our families, and our school staff. Because yes, indeed, not all family members are aware of this, of fentanyl. And a lot of times because of the stigma or lack of information, they think that this might be something that impacts someone else, not their family. But indeed, we need to break that stigma and increase the education. So schools absolutely are working really hard to increase this information to families, the accessibility, bringing it in all of our health classes, making sure that we have up-to-date information, training our school staff, making sure that our school staff have up-to-date information, specifically about fentanyl and how fentanyl is, how dangerous it is, and how it is so much more accessible and being used by younger population. Previously, perhaps our middle school teachers didn't think it was relevant and might pertain to them, but now we're seeing it at a younger age. So the first is really getting the information to our school staff, but then also to our families. Our role is to help increase communication with families, and that might be distributing at the very beginning of school, pamphlets, emails, education, having town halls just like this, and inviting families to come and have this discussion. And that will continue. We're just beginning, and this is just the beginning.
Thank you. And there's several related questions, so I'm going to keep you on for a bit, but I'm also going to be asking Kristen O'Connor, who is working specifically with youth on in the Santa Cruz Community Health. But a question is, are you able to give Narcan to kids in the high schools?
Thank you. And was that one for me?
Yes, yes.
Yes, and I did see a different a question phrased a little bit differently on is it okay if they have it? There is nothing that prevents our youth. Minors can possess Narcan, and that is one piece of information that is really important. There's a lot of information about Narcan and opiates that we want to get out there, and that is indeed you do not have to be 18 to be given Narcan. Schools right now do not have a process for schools to provide that, but we are working with the county SafeRx and trying to increase options and see what that would look like. Right now, our focus really is as well as getting it to students, but increasing the amount of staff that have it on campus. It is voluntary, but making sure that we may have had staff that had it originally that have moved on, and we want to bring that information to increase the amount of staff. And so it's not just the nurse, or it's not just in the administration, so that all of our teachers, our PE teachers, that they all have it available at any time.
Great. And there's another comment. Can the COE focus on getting information to schools in the health class, the speakers bureau? Yeah, just doing more in that realm. And I think maybe you referenced that, but I just seeing an emphasis on more, doing that more.
Yes, and there is a role, there's a place for it in our classrooms, such as PE and health. And like I said, a lot of it is we need to educate students and families, but also our staff specific about the dangers so that we can prevent opioid misuse and addiction, but also not just what it might look like to overdose, but what it might look like for at-risk behavior for someone that might be going down that path, so that we can intervene before it becomes a reality.
Thank you. And so there's a related question about youth that I think a number of people might be able to share answers. Kristen O'Connor, Alex Thruffall, others. How do we help young people who are trying to ease the pain from trauma or mental illness, and they're thinking they're being supplied Xanax or Adderall or other medications, then they're given something laced with fentanyl? How do we get them help so that they can get help and get access to safe medications? Alex or Kristen or Anthony, anyone?
I think that's a really great question. And what we're trying to do in our county is increase access for screening and intervention at every level in the schools and in the pediatrician office or the doctor's office, or in the mental health services that we have at our county. We've really worked hard to make asking about substance use common, and also learning how to offer resources such as substance use counseling. Even if somebody an adolescent doesn't have a substance use disorder, we want to intervene and provide education and support and really get to the underlying cause, which oftentimes is trauma or anxiety or something that's going on in the adolescent's life. So we've really worked hard in our primary care clinics in the county to have pediatricians asking questions at visits, to trying to get more access to not just treatment, but to prevention as well. We know that's really important.
Thank you. I see a really relevant question. Is there a way to test the substance for fentanyl? And it's a complex topic. Kristen, do you want to start it? We do have fentanyl test strips, and we have a lot that we can send out to you about fentanyl test strips, but would you like to talk a bit?
Sure. So fentanyl test strips are something that are not used clinically. It is a harm reduction tool that is used in the community to test a supply of something. It specifically tests for fentanyl. The issue is we don't know the supply. And so sometimes things that are contaminated with fentanyl, what's being tested isn't consistent throughout the supply. And so what might be tested might test negative when it's positive. So while it can be useful, there is room for error. So we always have messaging around the same messaging is just anything you're taking that's not prescribed is potential for having an unintended overdose. So to be super careful, and that's always having a bystander with you, how to recognize an overdose, but also using a really tiny amount just to test it out. These are just simple messages that we do to provide the community, but the fentanyl test strips are definitely something that have come on to the scene in the last few years, and we've made them readily available through our syringe services program in our county. We also have them at our clinic at Santa Cruz Community Health for anybody that is interested.
Thank you. There's so many good questions. Very quick one for you, Carter Jones. Does the Watsonville Police Department also carry Narcan?
Yes, they do, and all law enforcement agencies in Santa Cruz have access to it. So at this point, to my knowledge, every single law enforcement agency in the county carries it. I just don't know how much it's distributed, whether it's just to the patrol vehicles or at a patrol level, or if also detectives and other personnel carry them as well.
Thank you. There's also a question or a comment about our local bars. Rita, do you want to talk about what we're doing? We're doing that. So the question is, I'd like to see local bars as well as street teams making the Narcan easily available. Prescriptions are prohibitive. It should also be on campus and free in the bathroom. So Rita,
Yeah.
you can.
Yeah, thank you. Yeah, so SafeRx is a nonprofit coalition, and we do get access to Narcan, so I can deliver it to you all for free. And one project our team is working on, hopefully this summer, is doing outreach to bars and places where people may convene in after hours and high risk areas. And so we're going to do some Narcan training and provide them with kits at no cost so that there's no barriers, and have that resource, and actually partnership with the libraries too, because that's another spot that we've had some hot spots for overdoses. So I've been working closely with the libraries for those. But yeah, anyone can contact me as well if they'd like me to deliver Narcan for free.
Thank you. And then we also have that resource where there's lots of resources, not just Rita, because you'll get overloaded, Rita, but there's lots of places where you can get Narcan, the community clinics, syringe services program, lots of places. And then if you have insurance, if you have Medi-Cal, there is no copay, so it's very affordable. Okay, lots of things. Let's see, I had one that I wanted to take. Dave, are the EMS responders applying Narcan for patients found down prior to other evaluations? Are you able to answer that for us?
Yeah, I can say part of our protocols is if somebody is comatose and there's a suspicion of overdose or poisoning, then Narcan is part of the treatment for that. So it's frequently given, and we do track the statistics on how often it's given.
Thank you. Someone took me up on my prompt to hear more about these conversations with teens. It's so hard to double down on zero drugs allowed policy when we are ourselves experienced as kids. Most teens are bound to experiment, it seems, but the risks of things being laced is huge. And I so agree. And I'm going to ask Kristen O'Connor to start that, and then anyone else who'd like to comment. Thank you.
So the question is how to talk to teens about
just more
substances.
Yeah.
Well, I think it's just to provide a piece of education. And oftentimes, peers like to hear about what other peers are doing, or including them into the conversation. I like to give a lot of facts and just listen to see what they've been exposed to or experiencing. But to your point, I think peer pressure is real. And so having a safety plan that you come up with your child about what to do at a party, if there is something going on, and, you know, just to emphasize that they should not ever hesitate to reach out, call 911, call a parent if they're concerned about anything going on. I think that's what we've seen in the news are the worst case scenarios where they're, you know, the paramedics aren't called and then you have a grieving family. And so we just want to make sure that our teens really understand that. And also the motor vehicle accidents, suicide and homicide are the top 3 deaths among adolescents, and substances play a role in all of that. So we really do have to do a lot of education with our teens around that and educate them to make smart choices.
Thank you. And the recommendations to not starting a discussion that's fear-based, the materials in the Let's Talk are really useful, the resources I mentioned. And I think we need to have ongoing community gatherings for parents specifically to help support this process of learning how to talk. This is new territory for all of us. It's really a different situation, and we need to come together and support each other as parents and as, you know, adults that care about youth. And again, any of the panelists, please interrupt. Alex, did you want to say something?
Sure. I just want to kind of piggyback on Kristen's earlier comments, and there's sort of 2 components to this, is really educating our youth on experimental use and recreational use, and making sure they have the tools in place to be able to, you know, rescue somebody if necessary. I can speak from an operational perspective as chief of psychiatry and as a parent. It's a conversation I'm having with as many parents as I can. I talk to my children about it. Even my son asked me if he should have Narcan in his car for when he's going to a party. I think anything and everything you can do from an educational standpoint is a pathway to prevention. The other factor is, you know, sometimes experimental use when experimental and recreational use turns into an addiction, that's often linked to poor coping skills and possibly trauma in their background. And I think the community is doing a huge effort in trying to identify people that have suffered adverse childhood events, because the evidence just shows that they're at high risk for substance use later in life, and working as a community to increase our access to trauma-based services will go a long way into reducing substance use disorders in our community, and then obviously accidental death in that context as well.
Thank you. And I just want to say a lot of questions coming in, just more and more on our teens. One person asking whether we should be testing our kids more. Kristen, do you want to take that on, or Alex? Should there be more free testing of substance for teens, because no matter how much we talk, then they'll still take drugs? Anyone want to address that?
Is that testing, and it's probably not in the question, testing as in testing them for using substances, or giving them fentanyl strips to test?
I think you could answer both ways. I read it. I agree. It could be read either way. So why don't you talk about both?
Go ahead, Kristen.
I was just going to say, I think that the slide that Jen presented was really informative about changes of behavior. We never base our clinical decisions on one test. We always look at the whole picture, and you do that with your teenager as well. So anytime there's something going on where you're noticing a change of behavior and suspicious, if they're more sedated in the daytime, if they're having trouble staying awake, these are all things that are talking points and red flags for you as parents to say. Now, if you want to if you want to get an at-home kit and test it, that's fine, but what will you do with those results? So this is where it's really important to be plugged in with your local provider, pediatrician, family practice provider, or at least have a resource available to follow up with the results of that. Because we do have in our county substance use counseling, but it might take a little while to get into that. So you want to just be able to know how to handle that, and also how to refer them if you really are concerned that it's getting to the point of that it's interfering with school, then talking with the school. The school is prepared to talk to the parents about substance use and how next steps for referrals. And certainly we are more prepared now and the medicine side of things on how to treat it, because we do know that adolescents are undertreated when they are diagnosed with a substance use disorder. And actually, if we treat them, they're able to concentrate on things and get back to like their normal life. So we want to intervene early. We don't want them to have all the negative downstream effects of drug use. So we definitely rely on parents to come in when they come into the office to kind of fill us in on what's been going on at home. And we use that information to really try to make a really good treatment plan with the parent and the team.
Thank you. Thank you.
And I'll just, before Jen Busing chimes in, I just wanted to piggyback again. I mean, that's a difficult decision to make, to test your own children. And I think, you know, unfortunately, testing often has a huge stigma associated with it. So you're entering into a conversation, an agreement that becomes somewhat adversarial just because of the stigma around it. And I think to Kristen's point, talking with their school, talking with their friends, if you have access to them, to look for these behaviors that would be an indicator, and trying to have open and non-judgmental conversations around active use, because use is real. People do it, and people use substances a lot, and they can be very high functioning or sometimes not functional. Certainly when they're not functional, you want to be addressing it. And but then even with your high functioning individuals, it can be masked by appearing to be good at everything and doing well in school. So I think just having an open and consistent dialogue around risks of use and availability of resources goes a long way.
Thank you. And I just want to acknowledge that there are probably more questions than we can get to, and the panel has agreed to stay past 7. But just to know, we will not get through them all, but we will answer them all in written form to whatever ones we don't get to, and including the comments that have been made. There's a very, very good, or these are all good, but question about expiration of Narcan, because that's the one I have today to, if we had time to do the Narcan demonstration, says that it expired September 2020. I know that the federal government extended that in fact, this expiration, though it says 2020, it's probably still good. And I think we will do our best to get exact information about that. Does anyone on the panel know more than what I know, which is they did extend the expiration? Dave, I think you might be the best person for this one.
You know, I'm afraid I don't have specific information on that.
Okay, then we'll just, so the person who asked, and for everyone, because it's a question I have as well, but I did see the directive from, who would it have been from? CDPH was one place, the California Department of Public Health, that they were extending, and we didn't have to throw these all out. I remember that, but I don't have an exact date. A question about how old, what's the appropriate age for kids to carry Narcan? Kristen, you want to take that on?
I think any ages, you don't need parental consent to give Narcan to an adolescent. And I think we are actually trying to get it out there in the community. So I don't see a reason why you wouldn't give it to your teenager. In fact, we are handing it to teenagers at our clinic and and I know that we're trying to get it out in the community.
Thank you. There's also a question or a comment about offering treatment when there's an overdose in the emergency room, and I could not agree more. And we've actually started working closely with our emergency rooms so that they actually do that and don't just send people back out the door. Christian, we've had a lot of meetings, and I think we've moved the needle on this one.
We're really excited about this. In our county, our ED has Dominican and our Dignity and Watsonville Hospital started offering treatment in the emergency room and are prepared with a substance use navigator to make referrals for appropriate levels of treatment. So we recognize that one of the ways to prevent future overdoses is to offer people treatment. And so we're trying to tackle that in the emergency room as has been done statewide and nationally. It is the standard of care actually to offer that in the emergency room.
Right. And another important point that I meant to add, which was to make sure people don't use alone. The comment is, though, unfortunately, many who use opioids do so in isolation. Any suggestions? So we are encouraging that people not use alone. Anyone want to?
Yeah, I mean, if I could, I think the one way to think about this, and if you have conversations with your kids or any other loved ones, is to always consider the buddy system when it comes to using. And that means that if somebody is using and the other person holds off, they have Narcan available, they're there to provide it as a rescue. Unfortunately, Narcan does not work if you're by yourself.
Right.
And Jen, I added in the chat under answered that the Never Use Alone resource. So we do have a resource where if folks are using alone, they can call a number and they will set their location, let them know, tell the person on the other line that they're about to use, and they will use their substance. And then if they, Rita, are you there? Hello. If they're not responding, they will dispatch EMS to that location. Or if they say, I'm still here, I'm okay. And then, so that is another resource that we can give folks who are using alone so they can safely use or at least be known where they are.
Thank you. There's a kind of a concrete question, which is good. In the Narcan trainings, it says to wait about 2 minutes per dose. Fentanyl is more potent. How long should a person wait in order to administer additional doses? I know, 2 minutes feels like a lifetime when you're with someone who's not breathing. Dave, do you want to take that one on?
Sure, yeah, I could take that. Yeah, Narcan works pretty quickly, but it may not be as effective with a very strong opioid like fentanyl. The other thing is this is intranasal Narcan, and sometimes if there's a nasal obstruction or you kind of miss, they may not get the dose through one nostril. And so if you feel like you're not getting any response, I would try the other side, the other nostril, or do both nostrils with the administration. You can't really overdose with Narcan. And so it's important to make sure that you support the person's breathing while you're waiting for it to work. So that would be, mouth-to-mouth breathing, that sort of thing, to keep their respirations going. That would be important, not to wait for that.
Thank you. So there are several questions asking about law enforcement, and let's see, I'm moving around to find the question. Since we have Johanna from the DA's office, do you want to talk a little about the sort of the philosophy of investigations? They're wondering about if there is an investigation of suspected overdoses as poisoning or drug-induced homicides. And I know this is a very delicate question, but I think given that it's being asked, let's go for it.
So I'll focus, because we are not the investigating agency, on kind of the law side of it, which is what we would be looking at. If and when a police agency in our county brings us a case with sufficient evidence to establish guilt beyond a reasonable doubt for a death caused by fentanyl poisoning, we could file homicide charges. We've not been presented with that type of case yet. And I'm happy, I don't know if this is the forum or not, to get into the nuances of the law of homicide and how it might intersect with fentanyl poisonings. Suffice it to say, they're very complicated prosecutions with many legal hurdles, and we are actively engaged in training with our local law enforcement partners to try to make sure all the agencies are aware of those legal hurdles and the type of investigation that would be needed to generate sufficient evidence to charge somebody with murder in an overdose poisoning case.
Thank you. I'm just seeing another comment about a young person who died in Gilroy, and the parent did not get a response from the community when her child was poisoned by counterfeit Xanax in 2020. And we are working collaboratively with Monterey and San Benito counties. And so I think the efforts will extend. And hopefully we'll get more understanding. Thank you. So let's see, there was several questions about fentanyl in cannabis. The question is there evidence of dosing of fentanyl in cannabis, or is it in granules migrating from other medications by the cannabis supplier? And we had a discussion internally about that, and I think that's probably more the case. Alex or Dave or anyone else want to comment?
Well, I did type a comment on this. I think that yeah, if you do, we talked a little bit about how to talk to your kids, and recognizing that kids will experiment, and the best you can do is what we call a harm reduction approach. And one of the things is if they are going to use cannabis, and I mean gummies or vegetation itself, to make sure that it's obtained directly from a dispensary and not from the street. And I think that's a safer way to go. Not that I'm advocating the use of that, especially in kids, but I think that is one kind of safer approach.
Thank you. And I want to return to the comment or the situation that was shared of loss. And there have been several parents on this call who have shared their losses. And I think it's just so important that we are here to support you, and that we come together as a community to support you. And we did a little bit of research, and there are some support groups specifically for people who have lost loved ones due to drug poisonings or overdose. And so we'll put those supports in the Q&A document as well. And just our hearts are with you. Okay. Let's see. Is Narcan contraindicated for certain conditions that could also lead to unresponsiveness, such as epilepsy? Dave, that might be you. I'm pretty sure I know the answer, but go for it.
Oh, sure. Yeah, no, one can't assume that Narcan's not working because it's just not enough. In other words, you always have to look at other causes of a patient's medical condition. And certainly a seizure disorder can lead to a temporary comatose state that somebody will gradually come out of. But there's lots of other things that can cause you to be comatose, including cardiac arrest for other reasons. So one can't just stop at Narcan, but that needs to be part of the approach. Thank
you. And then there was someone who shared needing to use 10 to 12 Narcans. And it says, would it be possible that waiting 2 minutes for each dose would reduce the chances of that person surviving? It takes so little to OD. Wouldn't it make sense to administer one dose after the other, which actually was the case, I guess, in this patient? Do you have thoughts on that, Dave or Alex?
Can you repeat the question, please? Sorry.
Oh, sure. Or Dave can take it if he heard it. It's basically that people, do you really need to wait 2 minutes between each dose because of the potency of fentanyl? And the person was sharing that they used 10 in one case and 12 in another before the person responded.
Yeah, I can't say I'm an expert in sort of the pharmacology of Narcan and how quickly you could expect it to work. Dave, any information on your end?
Yeah, no, thanks. I can say my personal experience. I was a firefighter prior to becoming a doctor, and And my experience as a firefighter back in the 80s and 90s was that we could give microdoses of Narcan and get reversal in the field, but things are different now. And so, as an emergency physician, where we need to give pretty massive quantities of Narcan, doses that we would never have considered in the past. And so I've had to adopt our EMS protocols to increase those doses. So again, I think if you have somebody that you believe is overdose, go ahead and use it liberally, I think is the way to say it. But don't ignore other medical conditions that may be leading to their problem. Obviously, access 911 right away, support their breathing, do CPR if you have to, but don't just stop with the Narcan.
I was going to say the same thing. At least support their breathing as long as they have a pulse. And if they don't have a pulse, start CPR, right? So
I was just going to recognize that many of our unintended overdoses are polysubstance, and fentanyl just puts it over the edge. So there could be alcohol that's sedating, there could be benzodiazepines that are prescribed, but then you take something on the street or alcohol with it. So you have to get EMS involved at that point, at any point actually, because an overdose can be an ongoing medical event that can last for multiple hours, and it might be also reversing acute alcohol poisoning or other things. And we have our coroner here, who's amazing. I don't know if she would like to speak to anything that she has been seeing at all, just since we have her, and I haven't gotten to hear her talk yet. And she collects all of this data that we are using, all of us, to really try to understand what's going on in our county.
Thank you so much, Kristen. Yes, Dr. Fiore, please unmute and share with us.
Sorry, I was typing answers to another question. What was the question you'd like me to address?
I think about your recent, the data that you've been pulling together. I believe you have some things to share with the audience, and if you could summarize briefly.
Sure. We have been seeing a big increase in fentanyl deaths. I don't call them overdose. I usually say intoxication, but poisoning is also fair to use. We've been seeing a big increase since 2020 and continues today. Looking at the age of the people who are succumbing to this drug, we're seeing a lot younger age group than what we see in drug deaths in general. Dropping about 2 decades. In drug deaths in general tend to peak in the people in their 50s, and with fentanyl, we're seeing that peaking in their 30s and drifting down into the teens, something that I haven't been seeing since I've been here in the last 8 years. So it's prevalent, I think, with the young kids, with the experimentation and them gravitating towards pills, which may be counterfeit pills, is scary. And then also through the use of cocaine, where they're out partying, drinking, and they want to use a little cocaine and not knowing what they're getting when they're buying drugs on the street is a very scary thing for our youth. The marijuana, it's a harder thing for me to address. I mean, everybody that I test has cannabis in their system, and that just seems to be Santa Cruz County. So it's hard for me to say that everybody who is, out there smoking a joint is at risk for fentanyl, but certainly if they're buying these drugs off the street, it's Russian roulette right now. You have to be careful with what you're buying and where you're getting your drugs from, because it can happen to anybody.
Yes. Anthony, we're really fortunate to have you on our call today. And thank you, Dr. Fiore. We have learned that there is a large amount of money. There was an article, I believe, in the Sentinel talking about this, that there is money coming from the federal government. Can you talk a little bit about that process and share your thoughts on this, hopefully these funds that will come to Santa Cruz?
Are you talking about the opioid settlement money?
Thank you. Yes.
Okay. Okay. Yeah. So I put in I made a note. We got a settlement for the opioid for the things that the big pharma done, and we're sort of on hold right now about how to sort of when the money come in, what to do with it. Originally, it was loosely defined in how we could actually utilize the funds, and what we were going to do is sort of bring it in, having basically all substance, including fentanyl and other opioids, approach to utilizing the funds. But Senate Bill 1282 changed sort of, there's a bill was introduced, and it was Senate Bill 1282 that sort of restricted what you could use the funds for, or at least this is what is being proposed. And it's really the emphasis is on opioids and the homeless population. I think it was like 60% of the funds had to go towards that population. And most of you probably already know that there are other people who use opiates who's not homeless. And so what we are doing is tracking that particular bill to see what happens. And what we're going to do, we're still going to follow our process. And what we're going to do once we get the funds, is that we're going to basically have a stakeholder engagement, regardless of how the funds are going to be utilized, to sort of see what is the best way to sort of utilize these funds, and what the community needs and what the county needs, and sort of what's the amount of funds that we're going to receive from the settlement. So we're going to be sending out something in the future to sort of outline what our process will be. I was actually working on this project before and had to put a halt to it. So once we get to a certain understanding of what this funds and how much and what we can spend it on, we would be engaging the community in a process to ensure that we are meeting the needs of the community as well as the obligations of the fund. So thank you.
Thank you so much. Complex process.
Yes.
Yeah. Jen Herrera, before we close, do you want to add anything? I wanted to make sure every panelist got an opportunity to speak.
Yeah, I don't have anything else to add. Thank you.
Thank you for being here. So we'll go on a little bit longer, but I think we'll start winding down. And as I said, all the questions will be addressed, even if we don't get to them. There was a question about whether this information was reaching the homeless community, and it is. I'll just answer it briefly that we have our Harm Reduction Coalition, and we have the Homeless Persons Health Project that goes to encampments and does trainings and talks with folks. Does anyone want to add any more information? Jen, maybe that is where you can add to what I'm saying.
That is correct. We have our HPHP program, and we have outreach workers. I believe some of our HPHP healthcare program for homeless persons staff are on this town hall. But I don't have much more to add other than that it has been part of the general outreach and engagement efforts with people experiencing homelessness.
Okay, thank you. And there's a series of sort of comments and questions about, like, why is fentanyl in the drug supply, and why would a drug dealer do that? And because you're killing your clients. And then another person made the comment, well, because it makes folks addicted. Does anyone feel like they have a good way to summarize that whole complex dynamic?
Well, our partners in Monterey County summed it up that it's cheap, it's psychoactive drug. People who are using it like to use it because it just boosts whatever it is, and it's very cost effective. So that's a simple answer to that. There's a supply and demand here, and unfortunately we're still recovering from the opioid epidemic that was started when opioids are overprescribed and many people turn to the street supply. And obviously what we're seeing now is not necessarily that, but there was already a big demand for that. And then on top of that, you have just people who are using other things and are just getting caught up in this. So it's just overlapping underlying things that are converging to make this unfortunate storm of events happening.
Thank you.
I would add, and I'm not a law enforcement person or a narcotics person, but I would say that from my understanding is because it is so potent, it can be packaged in small quantities, small packages, and easy to smuggle across the border and so forth. It's fairly easy to make. It's inexpensive, as Kristen said. So all of those factors, I think, have led to this.
Thank you.
Just to echo what David Gilladucci just said. Yeah, we're seeing, I mean, a pound of fentanyl, can be turned over and cut usually down to like 5 or 6%. So you can mass produce a lot more narcotics that way and sell a lot more, make a lot more money. And no one's thinking long-term about their quote unquote like clients or the people that are using. Oftentimes people have a very short foresight into thinking like, okay, what can I get today? How much money can I make today off of selling? They're not thinking long-term about client health or anything like that.
Thank you. So let's see, I had, there's a question, do we have a youth advisory panel to share their ideas? Rita, do you want to talk about our youth grant?
Yeah, thank you.
Youth
And I added a response to that. We're working on securing funding to initiate a youth work group for our coalition and to be able to offer a stipend to have youth be on our advisory board. There's 2 prongs, I think, to that answer. We connect with Empower Watsonville, which is a youth coalition focused on substance use, and consult them for materials and a survey we're actually conducting right now. And then we are also part of a statewide grant called Youth Opioid Response, YOR, and that has been a way for us to really dig deep into this work and develop materials, focus on developing outreach and education for youth. Partner, the County Office of Education is our partner, and so we've done a lot of great resources and working on that Narcan policy with the schools, and just trying to reduce any barriers with that. So more to come, but hopefully we have a more official advisory and work group in the coming months. It's important. Thank you.
Great. And there's a question of whether we're going to be getting an FDA-approved nasal benzodiazepine reversible, or any conversation about that, Dave, or Alex, do you know about that?
Yeah, I was just typing an answer. Romazicon is used in the hospital very rarely, and only in cases where benzos have been administered as part of a procedure. The problem with Romazicon is that it can induce seizures if it's used inappropriately. So it's really not indicated in case of known exposure.
Thank you. So there's a question that whether it says many clients are surprised if fentanyl is coming out in their UAs and gets turned off by using this. Could we help if we had access to better strips? Where do we request these? So I think there are test strips. I'm not sure I understand the question completely, but there are test strips, fentanyl test strips at the syringe services. Jen, do you want to add anything else?
Just that they're free, and we do provide it at our syringe services program through the county. And it's open 5 days a week over in Santa Cruz, and we have Watsonville locations as well. And that can be found at our website, santacruzhealth.org/SSP for
Great.
our hours.
Great. And we also have on the Padlet in the SafeRx document, we have all the numbers. Thank you, Jen. So there's a question I've read about foods that can help reduce anxiety and what foods to avoid because they increase anxiety. Can that research be shared with teens? And I've said, yeah, of course. Anyone want to comment? Kristen, you're my local kids person.
Well, I was going to wonder if Alex has anything that he can suggest, since he's our psychiatry expert.
Yeah, just once again, can you repeat the question? I was just sort of browsing the questions.
Oh, okay. About whether foods that can reduce anxiety or what foods increase anxiety, whether that information could be shared or that research could be shared with teens. And I said, yes. Just didn't know if you wanted to say anything else.
Yeah, I don't have anything else. You know, I mean, anything that we can promote as being healthy living would go a long way. So
Yes. Good.
On all fronts.
Thank you. And then a question about whether one can taste fentanyl. Probably since we haven't tasted it, we don't know for sure, but is there any data on that?
I mean, I would imagine it's in such minute
Right.
doses that
That's true.
either
Good point.
you're going to drink your drink and you're going to not be standing if you've had enough of a dose that you might be able to taste. If it's more of a microdosing, you're not going to taste it.
Right.
That is pure speculation based on zero evidence. So I just want to make sure I make that statement.
I was speaking with the medical service director at the methadone clinic, and she was saying that she heard that it's being sold mixed with talcum powder and also aspirin because it's the same color. And so maybe you're tasting something like that. I don't know. This is all anecdotal.
Yeah, and we have an attendee on the line that has living experience right now that I'm texting with right now, and they said, yes, it is very harsh. You will know it when you taste it. So that's from someone that is using and has actively used. So that's helpful from their perspective.
Thank you. Yes, and I think there's also a comment, this is going back to the test strips, that they're not foolproof. And yes, we have this sort of chocolate chip cookie analogy about how you're just taking a part of the pill or the medication, and you may not, in fact, be sure. And so we actually have very specific instructions about the test strips that I'm hoping our team has put into the chat. I am not looking at the answers, but we do have a lot of very helpful information about the sort of pros and cons of the test strips. So the comment, Ben and Jerry's chocolate fudge brownie ice cream is a safe-ish alternative to street drugs. Thank you. Yes, and there are some other flavors actually. Yes. So there was one other, so there was a comment about our elected officials being part of these panels. We'll take that into consideration. And certainly, I'm sure every single one of them, if they're not watching now, they'll watch later. Alex, since you were perusing the list, are there any questions that you feel have not been addressed sufficiently or need to be brought up? And actually, anyone on the panel, you can help me out here. Anything that we feel we have maybe need to dig a little more into before we close?
Jenna, I think you've done a really good job at keeping track of all these questions, and I can't thank you enough for to you and Rita and your team for hosting this and really just having an incredibly open, honest, and effective conversation. I do hope that people who took the time to join tonight feel like they got some much needed questions answered, maybe not all of them. And I do want to note that we will be taking these questions and meeting to stand up a larger town hall so we can address a lot of these questions in more detail. And it's just a testament to the impact that SafeRx has had on our community by hosting this tonight, and all the great work that you in SafeRx and all your members, and HIP for all the great work you've done over these years. You've impacted the community in such a positive way, and I have every confidence that we can tackle this new problem and sort of reduce unnecessary deaths to the best of our ability.
Thank you so much. That means so much, Alex, coming from you. And I know that it's been a huge honor to Rita. You're great to work with. And there are also a lot of people at HIP behind the scenes who are not, showing their faces, but Ali and Suzette and Shruti and Amy and Celine, and help me, Rita, we don't want to miss anyone. Mason and yeah, just a lot of people helping to make this happen. And to all of you on the panel, we have to work together. And I think this shows how we, in part, how we do that. And Anthony, Jordan, Jen Herrera, Dave Gilladucci, Alex Rafal, let's see on my screen, Johanna Schoenfield, Stephanie Fiora, Kristen O'Connor, all of you, to each one of you, thank you so, so much for joining us. And for the people in attending, we couldn't do it without you. So thank you for sending in your questions. As Ali is saying in the chat, all of your questions, all of the resources, the recording, the slides, everything will be on our website. So please visit that. And we'll be getting together soon to, chew on this and really move forward. It's not easy, as all of your questions shared, and there's already been too much loss. We don't want more. And
Can I just add,
yes,
Jen, about
please.
International Overdose Awareness Day is a really meaningful time that we come together in our county to celebrate the lives of the people that we've lost and to memorialize them together. And I feel like a lot of people that joined today have just experienced terrible grief around that. And I want to make sure you know that we do have this event on August 31st that we, as a community, come together just to have grief, a time to share and talk about our loved ones.
Thank you, Kristen. So important to remember. And not with us right now on the panel is our Harm Reduction Coalition. Just a gratitude to them for all the work they do. And some of you have offered in the Q&A to share your experiences with us. Please reach to us. Our email is saferx@hipscc.org. We want to hear from you, and we want to work together and partner with you all. Anything else? Rita, do you want to close us out?
Yeah, I was just adding my email and name to the chat. So yeah, either SafeRx@hipscc.org or Rita at hipscc.org. And I really want to thank our panelists for taking the time after a long work day, I'm sure, to be here and present for the community to answer questions. It really means a lot. And also the community members for showing up. I know this is a really difficult conversation, but we have to have it. And we have to work together, because not one organization, even just on this panel, can address this. So it needs to be collective. We need to do this to have collective impact. And so I just thank you all for your time. And I just want to again share my condolences and hold space for those that we've lost and the lives that are affected. And we will continue this discussion, and we would love community input on ideas of what you all want to see at the next event. And we will do our best to make it exactly how the community wants. And thank you.
Thank you so much.
Thank you.